Folks, the first step of managing prediabetes is understanding what a prediabetes diagnosis means. Treatment may include lifestyle changes such as diet, exercise, and medication. If you receive a prediabetes diagnosis, it means you have a higher than normal blood sugar level, but it is not high enough to qualify as a diagnosis of diabetes. According to a 2014 review, long-term data suggests that lifestyle changes may decrease the risk of prediabetes progressing to diabetes for as long as 10 years. An earlier study showed that 5 to 10% of people's prediabetes progresses to diabetes every year. Prediabetes can also lead to other health conditions including heart disease and stroke. But you can reverse prediabetes. Watch the full video to learn more about this diagnosis and what you can do. Folks, let's talk about the symptoms of prediabetes. Actually, prediabetes has no clear symptoms. However, some people may experience a condition called acanthosis nigricans, which is a sign of insulin resistance. It involves the development of dark, thick, and often velvety patches of skin. It can be associated with polycystic ovary syndrome, PCOS. This discoloration usually occurs around your elbows, knees, neck, armpits, and knuckles. If you have received a diagnosis of prediabetes, it's important to talk with a doctor if you experience increased thirst, increased urination, especially at night, tiredness, blurry vision, and soreness or cuts that won't heal. Folks, these are the symptoms typically of type 2 diabetes and may indicate that your prediabetes has progressed to type 2 diabetes. A doctor can order a series of tests to confirm this. Folks, let's talk about what are the causes of prediabetes. Your pancreas releases a hormone called insulin. When you eat, so that sugar from your blood moves into the cells of your body and serves as an energy source. That is how insulin helps lower your blood sugar level. The causes of prediabetes are similar to those of diabetes, though they are at an earlier stage. They primarily consist of: first, insulin resistance. Folks, insulin resistance occurs when your cells don't respond properly to insulin. Second, increased metabolic disturbance. Folks, increased metabolic disturbance is a result of both worsening hyperglycemia, which is high blood sugar, and insulin resistance. Folks, the normal fasting blood glucose level is 99 mg per dl or less, while hypoglycemia, which is low blood glucose, is under 70 mg per dl. If you have prediabetes, your blood glucose levels will rise to 100 to 125 mg per dl. Once your blood glucose level goes above 125 mg per dl, you will receive a diagnosis of diabetes. Folks, let's also talk about the important question: how is prediabetes diagnosed? A doctor will need to order a blood test for an accurate diagnosis. This means drawing a blood sample to send to a lab. Results can vary depending on the type of test. You should take the same test twice to confirm the diagnosis, according to the National Institute of Health. Folks, because devices that measure your glucose levels, such as the finger stick test, are not used for diagnosis. Instead, a doctor will use one or two of these tests. Folks, here we have three very common things your doctor may ask. Number one is hemoglobin A1C test. The hemoglobin A1C test, which is also called the A1C test or glycosylated hemoglobin test. This measures your average blood sugar level over the last 2 to 3 months. This test doesn't require fasting and can be done anytime. Folks, an A1C value of 5.7% to 6.4% is diagnostic for prediabetes. A second A1C test is recommended to confirm the results. The higher the A1C, the higher the risk that your prediabetes will progress to type 2 diabetes. Number 2 is fasting plasma glucose test. During a fasting plasma glucose (FPG) test, a doctor will ask you to fast for 8 hours or overnight before you eat. A healthcare professional will take a blood sample for testing. Folks, if your blood sugar level is 100 to 125 mg per dl, it indicates that you have a prediabetes. Number 3, oral glucose tolerance test. An oral glucose tolerance test (OGTT) also requires fasting. A doctor will check your blood glucose levels twice. Once at the beginning of the appointment and then 2 hours later after you drink a sugary drink. If your blood sugar level reads 140 to 199 mg per dl after 2 hours, then the test indicates IGT or prediabetes. Folks, let's talk about the people who are at the risk of getting prediabetes. Prediabetes can occur in anyone, but certain factors can increase your chances of developing the condition. Research suggests that prediabetes is strongly linked to lifestyle factors and genetics. Here are some of the main risk factors for prediabetes. Age. People older than 25 years of age are at a higher risk of prediabetes. Number 2, body weight. If you have a body mass index BMI of more than 25, a doctor may want you to screen for prediabetes. 3, waist size. Having more fat around your waist than your hips can increase your risk of prediabetes. You can measure this risk factor by checking if your waist is 40 in or more if you are a person assigned male at birth and 35 in, or more if you are a person assigned female at birth. Number 4, race and ethnicity. Research has shown that prediabetes occurs at a higher rates in people who are African American, Asian American, Hispanic, or Native American. Resource disparities such as access to care may likely factor into this higher prevalence according to the Centers of Disease Control and Prevention. Number 5, diet. Regular consumption of red meat, processed meat, and sugar-sweetened beverages could increase your risk of developing prediabetes. Number 6, physical inactivity. Not only can getting regular exercise help you keep up a moderate weight, but it can also lower your risk of prediabetes. Family history. If you have an immediate relative with type 2 diabetes, you may be at a high risk of developing prediabetes. Tobacco use. In addition to increasing your risk of insulin resistance, smoking may also be associated with an increase in waist size, which is another risk factor for prediabetes. Last but not least, medical history. Certain conditions including sleep apnea, gestational diabetes, high blood pressure, and increased cholesterol or triglyceride levels may be linked to a higher risk of insulin resistance and prediabetes. First, let's talk about our last very important point, preventing type 2 diabetes. However, in this video, I will tell you superficially how can you prevent your type 2 diabetes, but I will also upload a detailed video on preventing diabetes. If you want to watch that, the link is in the description. Folks, according to CDC, losing even just 5% to 7% of your body weight if you have overweight can significantly lower your risk of developing type 2 diabetes. Other factors including high stress levels and smoking can also contribute to the development of type 2 diabetes. Making lifestyle changes is one of the most effective ways to keep up a moderate weight and prevent type 2 diabetes. Folks, here are a few steps you can get started to prevent type 2 diabetes. 1. Eat more fiber-rich foods such as fruits, non-starchy vegetables, nuts, seeds, whole grains, and legumes. Number 2. Limit your intake of sweets and sugary beverages, including soda, sweet tea, and sports drinks. 3. Aim for at least 150 minutes of physical activity per week, or about 30 minutes daily for 5 days per week. Number 4. If you smoke, consider quitting. Last but not least, manage your stress levels with meditation, yoga, deep breathing, and other techniques to lower stress. Folks, to conclude this knowledge, if prediabetes is left untreated, it can cause several health issues, including type 2 diabetes, heart disease, and stroke. But it is reversible and can be treated by making lifestyle changes. In addition to following a health-promoting, well-rounded diet, getting regular physical activity, and taking medications as prescribed by doctor can help prevent prediabetes from progressing. Guys, if you found our research in this video informative and helpful, then consider like this video and subscribe our channel. See you in the next video. Stay healthy and safe.